Hello, I'm Amru, your news anchor for Astro Awardme. Today in Science, there are reports that the wave of medicines being produced are changing in the coming years, bringing significant changes on how we see diseases being treated. They call this technology personalized medicines, at which it will bring a new mode of therapy for specific disease for each of the individuals. Here in our studio, we have two experts, Professor Ayla, a fellow from Integrative Pharmacogenomic Institute, I Promise, and Dr. Nick Raihana, a pharmacovigilance officer from National Pharmaceutical Regulatory Agency, NPRA, to discuss further on this topic. Prof. Ayla, can you tell us what is exactly this technology personalized medicine is and its role and applications of this personalized therapy?
Yeah, sure. First of all, I want people to understand that personalized medicine is basically a practice where a patient's drug therapy is tailored individually to achieve the best response and safety compared to current pharmacotherapy approach that uses one-size-fits-all model. So what is one-size-fits-all? It is a model where drug therapy regimen for a patient is made based on studies on population, not based on individual patient. So the role of personalized medicine is to provide opportunities to the physicians and other healthcare professionals like pharmacists to develop treatment and medication plans for patients who did not respond to medications as intended. So we know variability in drug response is influenced by age, nutrition, environmental exposure, and most importantly, genetic makeup. Let's say, for example, 10 people are taking the same medication for seizure, and all of them were expected to have the same response, which is the resolution of the seizure attack. However, due to variation in genetic makeup that affects how the body responds to medication, 7 people may respond well, while another 3 people may be unresponsive, or even worse, they might experience adverse effect from the drug. So what I'm trying to say is that just a minor variation in the gene can actually cause significant clinical consequences that may lead to severe adverse effects and even fatal. So to predict how a person will respond to medication, pharmacogenetic study is used. So result from the pharmacogenetic testing will be a guide to the healthcare professionals to decide on drugs or treatment protocols that can ensure successful treatment and minimize side effect. So for example, consider genetic variation in the metabolism of codeine, which is an opioid painkiller. Codeine is converted to morphine by a hepatic enzyme called CYP2D6 enzyme. So genetic variation in this hepatic enzyme will lead to too little or too much enzymatic action. So people with too little enzymatic action may experience ineffective treatment where the pain will not be relieved. Whereas people with too much enzymatic action may experience serious adverse events such as dependency to codeine. So that's basically conclude the role and application of personalized medicine.
That is an absolutely interesting way of describing this new technology. I can see the hype behind this, and of course, in my opinion, this will change on how we view the disease management. And like any other things in the world, the term perfect is not synonymous with this new technology. There are still arguments on the advantages and the disadvantages, or we call it pro and cons for this personalized medicine. And for this, can you explain this, Dr. Raihana?
Thank you, Mr. Amru. So there are a lot of pros and cons for the personalized medicine. The first benefit is preventive care. This is because genetic screening introduces the ability to use molecular markers that signal disease risk or present before clinical signs and symptoms appear. For example, women with certain BRCA1 or BRCA2 gene variation have up to an 85% lifetime chance of developing breast cancer and up to 60% chance of developing ovarian cancer. By doing this genetic testing, it can guide preventive measures such as increased frequency of mammography, prophylactic surgery, and even for chemo prevention. The second advantage is the efficiency of care by reducing trial and error prescribing. Nowadays, up to 50% of patients do not benefit from the first drug they are offered in the treatment. With personalized medicine, allows the physician to select an optimal therapy even for the first-time users, avoiding the frustrating and costly practice of trial and error prescribing. In addition, personalized medicine also reduces the risk of adverse effects. For example, warfarin dosing is typically adjusted for the individual patient through multiple rounds of trial and error, during which the patient may be at risk of excessive bleeding or further blood clots. It is because warfarin dosing is related with the proteins such as cytochrome P2C9, in which several variants of this cytochrome that I've mentioned are associated with reduced enzyme activity and lower clearance rate of warfarin. So now, the FDA recommends genotyping for all patients before a warfarin treatment, which allows for more precise dosing. However, there are still some limitation in personalized medicine. Of course, there's a lot of limitation, and of course, when there's a pros, there's a cons. And the major drawback of personalized medicine is money. This high cost of associated with precision medicine does not only come from the research and development, but also from diagnostic method and genetic testing. Also, an investment must be made to security infrastructure to protect the data. Lastly, another limitation is that the primary workforce also need to be prepared to implement personalized medicine in our healthcare system.
Thanks, Dr. Raihana, for the explanations. And like many other things in this world, time and money has always been the most common problems that can hamper down any technological progressions. And now we get back to Professor Ayla. Professor, I've read about an interesting article on the innovation that is already being trialed. This innovation is called 3D printed pill. Is it hold the same principle as 3D printer or not? Can you elaborate further on this, Professor?
Yes, as we discussed before, personalized medicine tailors treatment to the individual characteristic of each patient. So one of the technologies that enables tailor-made treatment is additive manufacturing through 3D printed pill. You're going to see it in the picture coming up. It has layers of active ingredients that are being printed into a pill. So far, there's only one 3D printed pill that has been approved by the FDA in 2017. It's called Spritam, which is an anti-epilepsy. So this technology is called ZipDose technology, which has been patented by Aprecia Pharmaceutical. These 3D printed pills allow the drugs to dissolve in seconds, which is a great advantage for people who suffer from epilepsy or for patients who have trouble swallowing. Today, Aprecia Pharmaceutical has become one of the key players in this industry that opened the door to customized pills, allowing treatment with different doses for each patient. I imagine that in the future, it may even be possible to print pills at your local pharmacy. A doctor could send a prescription to a pharmacy that uses a 3D printer to create a custom formulation based on the special needs of a patient. But getting here would, of course, take many steps and likely many more years.
It is amazing on how far have we come in terms of technological advancement. In your opinion, Professor, is there any other technologies, innovations that can be made to facilitate or encounter issues that are occurring in the personalized medicine?
In personalized medicine, the use of AI and big data platforms are currently being used widely as both allow a high volume of data to be analyzed quickly and provide us with better understanding of genetics. Over the past decade, the availability of genetic and health data has increased dramatically. Thus, it is crucial to develop a database to store and analyze the data. For instance, mobile apps can be developed to store and analyze the wealth of genetic information. This will allow users, especially scientists and healthcare providers, to quickly and easily search a comprehensive and worldwide database of genes, variants, and related diseases and drugs. Plus, patients also can benefit from these mobile apps as they will be able to access detailed information about their disease and prescribe medication. Besides, they also can search information on their genes and potential associated health condition based on their specific DNA or RNA sequence.
Thanks for the explanation, Professor Ayla. Dr. Raihana, Malaysia has always strived for advancement in healthcare system technologies. With a heavily subsidized system and technologies, we have been able to help our locals, foreigners too, enjoy a cheaper treatment. That there is a term called medical tourism that generates huge revenue for us. In the coming years, personalized medicine too will become a forefront in our medical setting technologies. And with that, how far is our current progress compared to other countries?
Many developed nations have already launched big initiatives in precision medicine in the past 5 years, including Malaysia, even though Malaysia is a little bit slower. In 2012, the Prime Minister of the UK launched the 100,000 Genome Project in England. The project aimed was to sequence 100,000 genome, which will include cancers, rare disease, and also pathogens. One of the patients have been the earliest benefactors of the project was a young girl with a rare disorder. She presented with a history of seizures, and despite many tests and investigation, the doctors failed to clinch the diagnosis. So the whole genome sequence was performed on her and both parents, and it turns out her sequence data reveal a deletion in one copy of her SLC2A1 gene. This gene plays a role in the uptake of glucose into the brain cells, so she was put on a ketogenic diet and her seizures have stopped. In the USA, President Obama launched a precision medicine initiative as known as PMI in 2015 with a USD 250 million grant, which this initiative similar to the UK 100,000 Genome Project that I've mentioned earlier, which will also perform whole genome sequencing on selected disease. Meanwhile, in Malaysia, there has been very little movement or response, but at least there's a movement, so it's a progress, right? So in 2018, Ministry of Health planned for precision medicine implementation in 3 phases. First, data infrastructure and genome sequencing. Second, data analytics and integration. The third one, personalized health and wellness solution. There are 2 institutions that had initiative toward this approach, which are USM and UM. First, the project under USM is known as Malaysian Node of the Human Variome Project, as known as MyHVP database. The goal of project is to create a genome single nucleotide polymorphism, or we call it as SNP database, of a major ethnic group in Malaysia, which include common disease such as thalassemia, GSIC-PD, H. pylori infection, and even tuberculosis. In addition, GEMS Lab is a public-private partnership with UM and Pathomics Health in Singapore. So they work together with tasks for targeted therapy with a high chance of targeted pharma investment, ultimately allowing patient access to precision medicine. So I believe personalized medicine can be implemented in Malaysia, even if it needs a long period of time, because doing something late is better than not doing it.
Thank you, both Professor Ayla from iPromise and Dr. Nick Raihana from the NTRA. We from the public will be eager to hear more from personalized medicine technology progress in the coming years. I bid you both success in your respective fields. To add, this is an excerpt that I found from an article regarding the impact of this technology to this era. If we look around, we will notice that we have a very differentiated demographic profile. From the multiracial community to the increasing aging population, the shift from acute to chronic diseases such as diabetes, high blood pressure, and also shift from infectious to non-infectious diseases such as cancer, other non-communicable diseases, and also rare diseases. All of these, precision medicines or personalized medicines might help them by taking into account the individual patient genetics, environment, as well as lifestyle data. And from this technology, it will produce a better diagnosis, improve decision-making process, more effective treatment, and also reduce wastage by avoiding unnecessary diagnostic testing and therapies. Next, we take a look at the impact of personalized medicine to higher education. Personalized medicine presenting an excellent opportunity for higher education to predict the future of the need of our communities. By this, we can observe the trend that we see in our societies and build on them, the academic program and courses that will benefit our communities in the future. According to a study by Allison at the Duke University on the perception of personalized medicine in the academic health system, survey have found that there is a lot of support from the public that calls for the provider and patient education in personalized medicine. Respondents or the publics have identified focus areas such as in training education, and research for improving personalized medicine technology. Given respondents' emphasis on educational needs, this may be an ideal time to address these personalized treatment needs in clinical training as well as in public education. Next, we take a look at the impact of personalized medicine in the global environment. Due to its very significant impact, personalized medicine technology right now is aiming at raising the global awareness regarding the current limitation and the necessity of personalized medicine in overpassing treatment problems, and hence the current crisis. Research community and healthcare providers try to improve not only the treatment strategies, but also in vitro diagnostic, including the identification of novel biomarkers or the study of clinical phenotype for a better disease prediction and response to drugs. The global personalized medicine market size was valued at $493 billion in 2020 and is expected to expand at a compound annual growth rate of 6.2% from 2021 to 2028. The growth of the market can be primarily attributed to the rising interest in biomarker identification, as well as monitoring of different biomarkers that can be later used for developing efficient personalized medicine and pharmacogenomics. The ongoing situation of the COVID-19 pandemic has propelled the demand for personalized medicine approaches, particularly in research application. These approaches are useful in understanding variation in an individual's susceptibility and immune response against COVID-19. The applications of personalized solutions has the scope in developing specific treatment solution for different patients based on the specific immunophenotype. Hence, personalized medicine approaches hold a promising solution for identifying genetic, biological, and environmental variables that could affect the vaccine response and also suggest the alternative dosage required by a certain population group. And to conclude, personalized medicine is the future. Stay tuned for the next sports session hosted by Mr. Tarbizi. With that, thank you for viewing Science section. And remember science, remember Astro Awardme. I am Amru Nazri. Good night.